The large intestine. Love it or hate it, knowing the literal ins and outs of this organ is imperative for understanding the final stage in our digestive process. We'll start with the anatomy of the large intestine. It starts where the small intestine leaves off at the ileocecal valve. The first part of the large intestine is called the cecum. This is a relatively bulbous part with an interesting little wormy appendage hanging off of it, the infamous appendix. There are other appendixes in your body, but this is the most well known. After the cecum, heading up towards your liver, is the ascending colon. It turns left at the hepatic flexure, where it generally curves down a bit as it heads towards the spleen. This part is called the transverse colon. At the splenic flexure, it starts to head south again as the descending colon. Somewhere, usually near the top of the pelvis, there is a transition to the sigmoid colon, so named because it often has a vaguely S shape. After the sigmoid colon, it enlarges a bit to become the rectum, and the final bit are the sphincters of the anus. Parts of your colon are intraperitoneal, which means they're relatively mobile within the peritoneal cavity, and other parts are retroperitoneal, which means they're tacked up against the back wall of the abdomen. The cecum, transverse colon, and sigmoid colon are intraperitoneal, while the remainder is retroperitoneal. The transverse colon has another attachment to the greater curvature of the stomach called the gastrocolic ligament, which is a part of the omentum. Just like all intraperitoneal organs, the intraperitoneal portions of the colon have mesenteries, which allow blood supply to and from these parts of the colon. The colon has a couple of layers of muscles. The external layer is thickened into 3 straps that run longitudinally along the length of the colon, called the taenia coli. These muscles are actually shorter than the colon itself, and when they're contracting, they cause the colon to form little lumps or saccules. The borders between these saccules are called haustra. This is a normal barium enema that was performed as part of a workup for a patient. You can see some of the anatomy we've been describing. The cecum is in the right lower quadrant. The ascending colon, transverse colon, and descending colon are well seen. The rectosigmoid colon is somewhat redundant and coiled up within the pelvis. The haustrations are nicely seen. The colon has a lot of different functions. The most obvious of these is the storage of waste products. Evolutionarily, having a relatively large reservoir allows us to go for some time without voiding and allows us to keep a clean environment. The second function of the colon is to absorb water. The small intestine delivers its liquidy content, called chyme, to the large intestine. The small intestines have done all they can with it, but there's more work to do. Officially, once the chyme hits the colon, it's renamed feces, or feces for you Brits in the audience. Of course, there are 1,000 other words we could use, but we'll stick with feces for now and maybe throw in an occasional poop. Anyway, the feces enters the colon at the cecum, and here's where the magic happens. This liquidy stuff is not usually what we poop out, so we know a lot of the water has to be removed. This gradually happens along the course of the colon, creating a sort of liquid gradient, with firm stuff being towards the end. The last function we're going to talk about relates to the bacterial flora of the colon. Maybe that should be bacterial fauna? Anyway, your colon is filled with trillions of little tiny bacteria. They have interesting names like Peptostreptococcus and Bifidobacterium. Overall, there's been hundreds of species described, and perhaps as many as 100 trillion individual cells are present. Keep in mind that's probably more cells that are in the average human body. These little guys can metabolize things that we can't, for instance, turning otherwise indigestible carbohydrates into things we can absorb and process. Depending on the type of bacteria and exactly what's being processed, this can be accompanied by a not-so-pleasant gassy side product. These bacteria are also a source of other nutrients like vitamin K, and they have various roles in immune function. This is actually an active area of research, and there's new things being learned every day. For instance, the somewhat hard to swallow but exciting new treatment like fecal transplant, currently under investigation. These little friends of ours also prevent not-so-friendly bacteria from setting up shop. Wiping out the good guys with antibiotics can leave you susceptible to some bad ones moving in and causing problems. There are some other functions too, but those are the big ones. Thanks for tuning in, and I hope you learned a little bit about the structure and function of the colon.